Hi, my name is Lacey Bueller, and today I'm going to be doing a presentation over family presence during resuscitation. So what I'm going to start off with is defining family presence during resuscitation, because essentially it is the opportunity for the family to stay in the room while the healthcare professionals are resuscitating a patient. Now, the resuscitation is called cardiopulmonary resuscitation, or CPR. This is an emergency life-saving medical intervention that is going to be used to revive someone who is previously in a non-responsive state. It's a pretty common occurrence in a hospital, so that also means that family presence during resuscitation is also a very common topic. So on the right, you're going to see a photo, and that is a representation of family-centered care. So family presence during resuscitation is a perfect example of family-centered care when it's implemented in the correct ways. So family-centered care focuses on communication between the healthcare professionals and the patients as well as their family. So the patient's wishes and the family's wishes are respected, and the family and the healthcare providers collaborate, and they create a good environment to work in. So next is a photo of a family at the bedside of a patient, and this is meant to show the effect that family presence during resuscitation has on families as well as healthcare providers and the patient. So next we're going to discuss the problem. So the problem is that there's extensive research done on the positive effects of family presence during resuscitation. And the effect it has on patients and families, but there's no education, there's no policies, and there's no procedures in place that addresses family presence during resuscitation in a lot of hospitals. So when there's no policies restricting family presence, there's also none that are implementing it. So this means that the decision is left completely up to the healthcare professionals that are working with the patients. So next, we are going to do opposing views and statement of understanding. So some healthcare professionals believe that the implementation of family presence is going to be detrimental because there's a risk for psychological effects and psychological trauma on family members. There's also a risk for unsuccessful resuscitation and failures and mistakes, as well as, so what comes along with that is litigation. So these are risk factors for family presence, and I agree with a lot of the scenarios that could potentially play out. And because families can be unpredictable, and everyone's an individual, and everyone has their own thoughts and their own beliefs. And it's a very stressful situation as a resuscitation. So when a family member is emotionally unstable, I understand that a situation could probably play out like that. But in my opinion, which is my position, the implementation of education, family presence during resuscitation, as well as the creation of policies and procedures, is going to help guide healthcare professionals to successful application of family presence during resuscitation. So when the family presence during resuscitation is applied correctly, it's going to decrease the family's experience with complicated grief, and then it's going to give them a sense of control and comfort, both for the family and the patient. So this is going to be the benefits. The next statement is the benefits. These are when appropriate policies and procedures regarding family presence during resuscitation are implemented, they can lead to exclusions of family members who have been deemed too emotional or a little bit too emotionally unstable, and they're going to be disruptive and distracting. They can be excluded from being permitted into the room during the resuscitation. But family presence during resuscitation also encourages autonomy for family members who just want to be present with the patient. They just want to be with their loved one during the resuscitation. So the addition of the education, the policies, the procedures, with family presence during resuscitation in clinical practice will decrease the risk of psychological trauma. It will decrease the risk of mistakes and the unsuccessful resuscitation attempts. And it also, along with that, will decrease the risk for litigation by the family members upon the healthcare professionals. So while all of this is going on, when these come together, it's going to simultaneously increase the satisfaction of the patient's family members. So next is a video. This video, to me, shows what my beliefs are, my position, and it also shows what the problem is with family presence during resuscitation. And I agree with it.